So typically, parents have really good instincts. I mean, sometimes it's a little rough on your first child, but parents tend to come in when they know something's wrong. And worst case scenario, we'll tell them everything looks great. But this instinct that parents have has led to diagnoses such as cystic fibrosis and some rare diseases. And so the parents will notice that their child is breathing funny and maybe using extra muscles, such as looking above the collarbone. You can see it sucking in a little bit up in here, using more of the rib muscles where the ribs suck in. Sometimes they may note my child turns a little blue or dusky around the lips. They breathe faster than usual. They make weird grunting noises when they breathe out, like and then, so parents typically see that this is not normal compared to my other kids or my neighbor's children. This breathing pattern is just not right.